Welcome to 360 Talks podcast. Today we have Dr. Abhay K.Pandae, an experienced interventional cardiologist trained across India, Switzerland, Canada, and the UAE. He is here to share simple insights on keeping your heart healthy and strong. Let's welcome Dr. Abhay Pandey to the show.
Good afternoon. I'm very happy to be here. I would love to share my experience with our people because heart disease is the major killer all over the world. If we take all the causes of death,
Mhm.
the heart disease is more than all other causes put together, including cancers and other things. And heart disease is mainly preventable. If we have a good lifestyle, we can prevent part of our heart problem, and we can live longer, we can live better, and we can enjoy our life.
Well said, doctor. So, since you have global experience on healthcare, so what is your take on how people are evolving towards health? And since you have been in Canada, Switzerland, India, as well as in UAE, so what is the diversity you see towards health?
See, people in India, probably because of lack of facilities
Mhm.
or awareness, are less well informed about the heart and heart problems because of the rat race of the life and other things. The main problem with the people from India is that we have inherited a special kind of problem. We have what we call as Indian ischemic heart disease. We have, because of the foreign rule and habits of fasting and not doing a regular exercise, the heart disease is more common in Indians. It is more virulent. It
Mm.
causes more damage or this. Like when I did angiography for a patient with heart attack in India, I would get a full artery damage. Whereas when I practice in Switzerland or in Canada, the arteries were not so badly damaged.
Okay.
Our main problem starts one with our genetics. We have inherited what we call as insulin resistance, which leads to high triglycerides, which leads to paunch, the
Mm.
visceral obesity. Usually in India, the high cholesterol is not the major problem,
Okay.
but we have two types of the cholesterol. One is called as good cholesterol or HDL cholesterol, and one is called as LDL cholesterol or the bad cholesterol.
Mm.
Bad cholesterol causes heart attack. HDL cholesterol prevents heart attack.
Mm.
What HDL cholesterol does is that it takes out the bad cholesterol from the circulation.
Okay.
And unfortunately, we are born with low HDL cholesterol, low
Okay.
quantity of the good cholesterol.
Mm.
And usually in India, we did a study long back in JJ Hospital where we found out about this, and the bad cholesterol was not very high in
Mm.
our population.
Okay.
However, it is very high in America, Canada,
Mm.
Europe, and other things. This now our Indian people, when they migrate to a rich country like
Mm.
UAE,
Mm.
like Canada or America, they adapt to the Western style. They
Okay.
start eating cheese, they start eating rich food
Mm.
without taking the good part of the Western society, that is exercise.
Okay.
That is very, very important that
Mm.
we don't do exercise.
Mm.
And it is very, very important that we should do exercise. We should walk for our heart to
Okay.
prevent further problem.
Mm.
So that is one important thing.
Mm.
Another thing is our people do not do, as I already mentioned, exercise.
Mm.
The food is bad.
Okay.
Even though many of our people are vegetarian, but our vegetarian is a corrupt vegetarian. It
Mm.
is full of trans fats, it is full of carbohydrates, and not the healthy part of it.
Okay.
So that food is also bad. Smoking is quite prevalent.
Mm. Okay.
Most of our people are smoking. Obesity is now becoming a very, very important issue. And obesity leads to diabetes, high blood pressure, and heart problem. When I practice in Switzerland or in Canada, if the patient was less than 60-year-old, we used to
Okay.
call him
Mm.
young. and it used to be less common to have a person who was below 60 years.
Okay.
But in last 25 years that I'm practicing in Dubai and UAE, most of the particularly Indian patients are below 40 years.
Okay.
We get heart attack at very young age. This is because we don't do exercise, we eat bad food, take smoking, we don't treat. And everybody from India is super doctor.
Okay.
They don't follow the medical advice and they decide what is to be done. That is another important issue that our people should understand. Then we must treat our the risk factors like diabetes, which is very high in Indians, high blood pressure, high cholesterol. And these three things, or in all these issues, are chronic conditions.
Okay.
And they are silent killers. You will not know whether you have diabetes unless you check for it. You will not know whether you have high blood pressure unless you measure it. Same is with cholesterol. And if we don't find out, we will come to know when it is too late.
Okay.
So a regular checkup, a healthy lifestyle, no smoking are very important. You can't change your genetics, you can't change your parents, but you can change your lifestyle and avoid lifestyle related disease. And heart disease is the main killer.
Okay. So, as per your experience, what are the symptoms and signs people ignore, which is a sign of heart attack in future?
Basically, we should have a regular checkup. If you get any unusual chest pain, get it checked. Check your blood pressure every year. If you have your parents have heart issues, blood pressure, diabetes, no age is bar. I have young patient like 18 years old. Just few days back, I had another patient who had a massive heart attack, which is who was only 22-year-old. So no age is bar, and you may not have a typical chest pain. You may have when I get a patient who comes with a typical chest pain,
Okay.
I know that this patient has read some book. His colleague has got heart attack and he has come. Another one important thing which I have seen many a times, chest pain is mistaken as a gas and gas is mistaken as a chest pain. So do not attribute any gas or do not decide. Go to the doctor, check your thing if there is a doubt. That is very, very important.
Okay.
So the main symptoms of the heart problem would be chest pain. Chest pain may be near your sternal area, what we call as a retrosternal chest pain. It may be on the left side. It may get referred to, or you may feel pain in your left hand. You may have breathing difficulty. You may have fast heart rate or palpitations.
Okay.
These are the symptoms. Other like swelling of the feet, breathing difficulties. So suppose you were climbing 2 flights of stairs and then all of a sudden you can't climb half the be suspicious whether there is a heart is getting weak or otherwise. So all these symptoms, and when in doubt, check.
Okay.
Do not ignore. Do not decide for yourself, oh, this may be gas with this. And in ladies, the typical symptoms are not always present.
Okay.
That is very important. The heart disease in women is a very, very important issue because the main killer for the ladies is heart disease.
Okay.
And many of the people, they have a misconception or myth that women, ladies do not get heart attack, which is totally wrong.
Okay.
So their presentation may be slightly late. Up to the menopause, God has given them some protection. But after menopause, they catch up with the mens.
Okay.
With this. So they should never ignore. Then in pregnancy also, they should take care. But they should check for diabetes, blood pressure, and other problems.
Okay.
But remember, heart disease is the major killer even in ladies. And this myth that ladies are protected from heart problem should be avoided.
Okay. That's really a brief way of like you have explained how to like maintain the health. So the next question I want to ask you is like, what is the main important factor for heart disease, which is like stress lifestyle, or diet? In which one of this might be the most common, like highest place, role to like get a heart disease?
I think all three are equally same. You can't, in a given
Okay.
person, somebody, the small stress also will be there. The problem with the stress is that it is unquantifiable.
Mm.
You cannot quantify.
Okay.
So stress is very important.
Mm.
Diet equally important. Exercise is very important. Not to smoke is important.
Okay.
Smoking is like committing a slow suicide.
Mm.
So we should never smoke.
Mm.
And this one important thing, you may have read that so many fit person died, this because they don't sleep. A nice 8 hour sleep is
Okay.
equally important for heart health. You must have a good sleep, good exercise.
Mm.
You must walk. You must do. American Heart Association recommends that every day we should walk 10,000 steps
Mm.
or
Okay.
4 kilometer walk. That is there.
Okay.
Meditation plays important role
Mm.
for taking away your stress,
Mm.
giving your heart rest, and this pranayam, the breathing exercises. Pranayam is basically breathing exercise.
Okay.
It helps to control your blood pressure. It calms your mind and
Mm.
it prevents heart problem. So
Okay.
one should be active. One should do a stress management. Somebody may like to have listen to music and this. So all these are important.
Okay.
And for a individual, a stress may be more important for individual B exercise. But in general, taking care of all the risk factors
Okay. Mm.
is important. Diabetes, blood pressure, heart.
So since we have currently a lot of development on procedures and techniques, so which type of procedure or technique you feel that it have made your job as a doctor like eased to like educate the patients, and or they are more aware of this, how to take care of them? So what is the highest like good procedure or technique you feel that it's helped you?
See, angioplasty, coronary angiography, and angioplasty have changed the world.
Okay.
Absolutely changed the world. I remember my college days when we used to keep the patient in bed for 6 weeks.
Mm.
People used to die. And now when patient is getting heart attack, if he comes within 30 to 60 minutes, his life is saved. And so many people. Coronary stenting is very important and it saves life.
Okay.
So coronary angioplasty and stenting, there are different types, but they have changed the whole world.
Okay.
My teacher, Andreas Grundzig and Bernard Meyer, I was lucky to get trained with them in Switzerland. They started this procedure, and now it is the most common procedure. The stent saves life. In addition to this, however, I would like to stress here is it is better to prevent the heart problem than treat it.
Okay.
When the patient comes with heart attack and I do his angioplasty or bypass surgery, it is like house is already on fire. You prevent fire by having good habits,
Okay.
taking care of risk factors and this.
Okay.
But coronary angioplasty and stenting are miracles for patients.
Okay. Okay.
One important thing I would like to stress here that 50% of the people who die of heart attack, they die within the first hour and they never have pain in their life.
So, like heart disease is more of common from previous generations. But if we can see as a commoner, I can see that it have been like increasing rapidly. So, what is the age groups these days? You think that heart disease is becoming more and
No
more?
age is bar. I
Okay.
have seen patient as young as 20-year-old, even
Okay.
younger to that, to older age group, up to 60, 80 or more. So no age is bar. If you have any unusual symptom, get it checked. If you have a family history of heart problem, diabetes, blood pressure, be
Okay.
more cautious. You can do certain tests like treadmill stress test to diagnose. You can do calcium score. You can do CT coronary angiography as and when indicated
Okay.
with this. But be most important, be aware that there can be a problem. The young people are particularly in modern society. They have a lot of targets,
Okay.
job insecurity,
Mm.
and then they don't get time to do exercise
Mm.
or
Mm.
rest
Mm.
because they have to keep their job, they have to
True.
survive.
Mm.
So we have to manage all this. And our Sheikh Hamdan ruler,
Mm.
he has started 30 by 30 fitness program.
Okay.
All such issues should be brought to the notice
Okay.
of the people.
That's well said, doctor.
Yeah.
So,
Another important thing is that everybody, all people should know how to do CPR,
mm.
cardiopulmonary resuscitation.
Okay.
That can save lives.
Mm.
And a basic training of how to do CPR will help. So
Okay.
we should have a campaign of doing cardiopulmonary
Mm.
resuscitation if somebody gets heart attack
Okay.
or this. And it is very simple. And every public place, now every plane of the Emirates has what we call as AED.
Mm.
We need to give a shock to save some person when
Mm.
he has a cardiac arrest. So all people should have basic knowledge of CPR,
Mm.
which should be taught in schools in
Okay.
this,
Mm.
because doctor will take time to come.
Mm. Mm.
But somebody who is a liftman,
Okay.
he can save somebody's life
Mm.
or this. In early 70s and 80s in Seattle, we did Seattle Heart Watch,
Okay.
where the people were taught how to do CPR, the liftman, the bus drivers, and taxi drivers, and there was a drastic reduction and a great improvement in survival.
Mm.
So, such programs also should be done in place like Dubai, which
Okay.
will save more people, which
Okay.
will save your near and dear one.
Mm.
We just, I think, a few days back, there was a young boy after Diwali
Mm. Mm. Mm.
celebration, he
Yeah.
died.
Yeah.
If
Yeah.
there was a person who knew how to do CPR
Yeah. Mm.
and give AED shock, he
Okay.
would have been alive today.
Yes. So if while he was hanging around with his friends, if some of the
Yeah, they
similar
knew
kind of
how to
aged,
do CPR, and it is so
yes,
simple.
yeah, 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 yeah. I
It is
guess
so
that's a
simple.
basic kind of
Yeah,
things schools can also like
yeah.
adapt and teach.
They should teach from the young age.
Hmm.
Wives should be taught. The cab driver should be taught.
Hmm.
All the hospitals should have those AEDs and training. It is not difficult.
Okay. So that was really good, like the experience which you have shared and the real time things. I guess these are not that's something like very technical and every person can adapt in their life. So at, like we are in our end of our podcast now. So what is the one simple habit if everybody have to like adapt? The listeners today on this podcast should adapt for a healthier heart. What that would be?
Do exercise. Walk for your heart. Heart will work for you. Do
Okay.
regular exercise. Never smoke.
Mm.
Eat healthy diet.
Mhm.
Don't take alcohol or fatty foods. Avoid carbs
Mm.
and take adequate rest.
Okay.
A relaxation, sports
Mm.
is the best thing.
That's really good. Thank you, doctor. Thank you for being here today. So, you have shared a lot of important aspects today, which can help the listeners to like adapt a healthy life, I guess. So, inshallah, many more podcasts to do with you
Yeah.
and to spread a lot of knowledge which you possess to the listeners.
Many thanks. I enjoyed with you, and I hope the people in UAE and Dubai
Mm.
take advantage from this, and they live long and they live in a good shape.
Okay. Thank you. Thank you, doctor.
Thank you.